This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan. Hey beautiful soul, it's Jacqueline here from the Labia Chronicles, where I discuss all things lichen sclerosus. So if you have lichen sclerosus and are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to this channel and keep on watching. And if you have a friend or family member with lichen sclerosus and you want to learn more about the physical and mental aspects of living with lichen sclerosus so that you can better support them in their journey, then please subscribe to this channel and share it with them. Alright, so in today's video, we're going to have a more casual sit down and chat kind of video. And I'm going to be discussing my journey into remission. So it's not going to be very sciencey or technical. So if you are looking for a more technical video on lichen sclerosus and remission, I will leave a link in the description box below with a video that I did on that topic. Before we jump into things, please be sure to get your free lichen sclerosus ebook that I have. You can get that at losslabia.com/ebook. And then if you struggle with lichen sclerosus and painful sex, you'll also want to pick up my ebook on lichen sclerosus and dilators, which you can get at losslabia.com/dilator ebook. All right, let's jump into things. Okay, so I'm not going to lie to you. My journey into remission was kind of an accident. And what I mean by that is, at the time, I didn't really have much information about lichen sclerosus. I didn't really know what it was. I didn't know how to treat. I didn't even know that remission was a thing that you can get into with remission. I really didn't know anything. So it was kind of a bit of an accident. And while I didn't have any explicit knowledge about what remission meant and how to get into it, I think that, there are some things that I kind of intuitively knew that would be supportive for my journey, regardless of if we were talking about remission or not. So we're going to kind of dive into all of that and how I kind of got into remission without really knowing that it was a thing and without having any knowledge of how to get there. So let's start at the beginning, when I was diagnosed. Now, I do have a longer video on my diagnosis story, so if you're curious and want to check that out, I will leave that linked in the description box below for you to check out after you're done watching this video. But I'm going to give you kind of like a Cole's Notes, really quick version of my diagnosis story, just insofar as it pertains to kind of my remission journey. So I was diagnosed in April of 2019, and I was diagnosed by my general physician. She diagnosed me because I had both the classic symptoms and the classic signs of lichen sclerosus, and to her, it wasn't even a debate. So I do have a video explaining the difference between signs and symptoms, and that's a really, really, really important one to watch. So again, I will link that down in the description box below. I'll also leave a card up here or here for you to click on if you want to go check that out. But I had both the signs and symptoms, so it was a pretty clear diagnosis. So she made that diagnosis and gave me a prescription for clobetasol. She said to use this daily, and that was kind of it in terms of instructions with respect to how to use my medication. Now, I'm in Canada, and so the typical protocol here is if your GP diagnoses you, they are going to refer you to a specialist to kind of follow up and stay on top of your case. So for me, she referred me to a gynecologist, and that actually came with a 9-month wait time. So for 9 months post-diagnosis, I was kind of on my own. I was kind of just, exploring and experimenting and kind of didn't really have much of a clue as to what I was doing. So treating my lichen sclerosus was one of the ways that I got into remission. So let's kind of talk about what I did for treatment. So for treatment, I kind of treated a bit, conventionally, but unconventionally, and maybe that'll make sense once I kind of explain a bit more. So my doctor did give me clobetasol, and she had told me to apply it daily until I could see my gynecologist. Now, I'm sure she didn't know that my wait time was actually 9 months, or at least I like to think that she would have instructed me differently. I like to think that she just thought I was going to get in a month and I would use it daily for a month and then talk to an actual specialist who would put me, on a more specific dosage, based on how I was presenting clinically. But suffice it to say that, pardon me, it was a 9-month wait time, and I had no instructions other than apply it daily. So I did apply it daily, but I did some things that were kind of maybe not the best. So, or at least not how the literature explains, the typical kind of general protocol. So for one thing, in the beginning, I would actually apply it daily, but like 2 to 3 times a day, because honestly, I was just so desperate to make the symptoms go away. And in my head, I was just thinking like, okay, the more medication I use, the quicker, I'll feel better. Not knowing that that's actually a little bit too much, and that can kind of be harmful for the skin. But, I didn't know any better. I wasn't given any proper instructions from my pharmacist or from my doctor. So I was really just doing what I thought was right. So I don't really hold myself on the blame hook anymore. I've let myself off. But yeah, so I was applying it daily. Not exactly a traditional way of applying it, not for 9 months anyways. And then another thing was I wasn't really applying it optimally. So what do I mean by that? Well, how I would apply it was I would take a little bit on my finger, and I wasn't even told how much to use. I think I just, put a little blob, and I would apply that to like my bone dry vulva. Like I would take a shower, and then I would dry off with a towel, and then I would take like, what's it called? Hair dryer. I was gonna say hair machine. I don't know what the heck I'm going with that. I mean, technically it is machine. Anyways, so I would take my hair dryer, and then I would like blow dry on cool heat to make sure that I was like dry. Then on top of that super dry vulva, I would take my clobetasol and I would basically just go, done. That's it. I didn't rub it in. I didn't really spread it. I just kind of globbed it on and moved on with my day. Now, that's not necessarily a red flag or anything terrible, but according to the Center for Vulvovaginal Disorders, there is a better way to optimally use your steroid. And that involves things like soaking and rubbing it in, but I'm not going to get into this because Kathy at Lichen Sclerosus podcast did a phenomenal interview with Dr. Krepp, who explains the ideal way to use your steroid medication. So if you have not watched that, I highly recommend that you go to lssupport.net/Dr. Jill, and I will leave a link in the description box below. Check that out for information on how to best use your steroids. But at the time that I was doing them, this interview didn't exist. There really wasn't too much out there, and I couldn't really find much guidance, and they just said apply it daily. So that's what I did. Once a day, done. So I wasn't really using it to their fullest potential, let's say. But that's how I was treating for those 9 months. And I will say that in those first few months, so maybe the first like 2 months or so, I actually felt like my symptoms were getting worse and not better. So I felt that my itch was way more intense, and my fissures, I felt like my fissures were getting worse and they were more irritated. So it actually felt like I was kind of stepping backwards using the medication, but again, I didn't really have any resources to tap into at the time. And when I expressed this concern to my doctor, she said, that's okay, just keep using it. Eventually it's going to help. Okay. And so I did, again, because I didn't know any better. But nonetheless, those symptoms did eventually start to fade and kind of improve. I do have a blog post on the topic of progress in lichen sclerosus, and I'm also going to make some videos with respect to, what can you expect in your healing journey with, what can you expect with your medication? How quickly can you expect to see results? Stuff like that. But you can check out that blog post where I kind of talk about my journey. And it definitely wasn't, a clean kind of linear trajectory into feeling better. It was very up and down. I had a couple months where I was feeling really good, and then I had a month where it was just like awful and things were flaring. So, I just wanted to kind of state that for anyone that kind of is watching this and kind of expects or presumes that when I say I used it and started to feel better, that it was a clean kind of trajectory. And it wasn't. And to be honest, it's not for most folks. It can be and amazing. I hope that that's the case for most people, but if it's not, that's totally okay and totally normal. So that's treatment. I now want to talk about 2 other things that I did to kind of support and get me into remission. Again, not knowing this wasn't a goal for me because I didn't know that remission was possible, but these are things that kind of looking back in hindsight, I think were incredibly helpful for me. So when I was diagnosed, I felt my mental health plummet and spiral hard and fast. And I knew that I was going to need some support for this, that this wasn't something that I had enough tools to adequately address on my own. I knew that I needed professional help. So what I did was I Googled a sex therapist. I said like sex therapy near me or something. And then I found a bunch of clinics and centers that are kind of like sex therapy focused. And then what I did was I kind of went through each therapist's profile and found one that really kind of sang to me. And, when I talk about this, I mean, the person that their specialty, it really seemed to fit the issues that I wanted to address. And some of these were, issues about low libido and sexual dysfunction and painful sex and fear of penetration and sexual trauma and body dysmorphia. So I had a lot of disgust and shame towards what my vulva looked like. So I had a lot of these issues and I had a very clear idea of what I wanted to talk about. Now, it is absolutely okay for you to see a therapist or counselor, just a general one. That is totally okay. I just wanted someone that really focused their research and their energy on specific sexual issues. I wanted someone that kind of really focused and worked in that area. So I found a sex therapist and I started seeing her bi-weekly, probably for all of those 9 months, to be honest. I mean, sometimes it might have been like a longer interval, so maybe like 2 weeks or 3 weeks or something. But I did see a sex therapist to kind of work on all of the fear and all of the anxiety that I had. Those are really big for me. And then also work through the grief process. So that was incredibly helpful. And I think that really helped bring me from a high stress, high anxiety state kind of somewhere down into the middle so that things felt not perfect, not ideal, not, it wasn't an erasure of, my anxiety, my fears, but we really were able to kind of dim down the light and bring it to something that felt manageable and okay and safe for me. So that was really, I think, incredibly helpful because we do know that stress is a huge trigger for lichen sclerosus. So when we're stressed, we can, cause a flare or cause our symptoms to kind of magnify. And of course, when those symptoms magnify, what happens? Well, we get stressed. And so you get caught in this stress cycle. And I talk a lot about that over on my Instagram and on my blog. But I knew from, having other chronic conditions that was something that really needed to be addressed and that I could treat with clobetasol till, the cows came home, but I absolutely needed to address that mental health side. And for me, that mental health side was profound enough that I was like, no, I need a professional to kind of guide me through this. So that was another thing that I did to kind of help get me into remission, because by calming that stress and bringing that stress down, I was really doing my body a favor and allowing it to kind of heal. Now, as many of you know, painful sex and tearing with sex and pelvic floor dysfunction were, these were like really big for me. Painful sex was one of my first lichen sclerosus symptoms, and the pain that I would experience was excruciating by the time that I was diagnosed. It was so intense that I told my husband, we can't do this anymore. I'm taking sex off the table because this is gonna kill me. Like, well, not literally, but I kind of felt like that at the time, to be honest. And so I knew that I also wanted to address the sexual health side because, one thing that my doctor did say that I do remember was she said, this can cause sexual pain, sexual dysfunction, and really impact your sex life. And I remember feeling both defeated by this, but also like there was a bit of a F you kind of attitude where I was like, no, I'm not ready to give this up because this is something that matters to me. So in addition to getting a sex therapist, I got a pelvic floor physical therapist. Now, to be clear, in both cases, this was not recommended to me. All I was given was clobetasol. But again, I knew I needed to address that mental health piece. And on the physical side, that wasn't recommended to me. But here's the thing. I have been in physical therapy for like over a decade at that part. I have a condition in my back called degenerative disc disease, which causes me a lot of, and I have it in the L4, L5, so a lot of low back pain and low back issues. And when you have that, you can sometimes get glute involvement and hip involvement and a bunch of other things. So I was no stranger to these kind of, rehab centers. And in all my time there, I remember noticing when you're sitting in the weight room, like waiting for your physical therapist to come out, you just kind of like read the posters on the wall and stuff. And I remember reading that they had a pelvic floor physical therapist there. And I was very curious about that at the time. I didn't think much of it in relation to me, but it kind of stood out that, they have someone that focuses, really heavily on the pelvic floor. And, it kind of listed out what they do. So there's a lot of like pregnancy stuff and urinary issues, but there was also pain with sex. And so in that moment when she was telling me about the sexual pain and sexual dysfunction and sexual health issues that can come with lichen sclerosus, I kind of, in my time traveled to that moment when I was reading that poster on the wall, and I thought that's what I need to get for the physical side of things. I want to address the painful sex aspect. And I thought that a pelvic floor physical therapist could be a good person to go to. And that was right. I am so glad that I made that decision. I gained so much tools by going to pelvic floor physical therapy. And I'm not going to go deep into all of my physical therapy stuff because I blog a lot about that. And I have separate videos on pain with sex and dilators and my journey with all of that. But I will highlight some things that I found really helpful. So one thing was when she did the internal exam, so she inserted just one finger into my vagina, and she asked me to do a contraction. So she asked me to kind of tighten the muscles, which is known as a Kegel or Kegel, depending on how you pronounce it, depending on where you live. So she asked me to contract the muscles, which I was able to do pretty well. She said, okay, yep, like you have a good, healthy strength. And so I'm like this, and now my finger kind of looks like a hot dog, but we'll ignore that. And then she said, okay, now I want you to release those muscles. And here's what happened. I'm going to go closer. I couldn't release them. It took me maybe a minute to release. And that immediately stuck out to me. I thought, wow, okay, so I'm really good at tensing and bracing, but I have no earthly idea how to relax my pelvic floor. And that really stood out to me because I knew that that is working against me in terms of painful sex, because if I'm tensed up against, something that's trying to be inserted, then of course it's going to be uncomfortable and painful and maybe even cause tears if there's tissue issues, which of course there are many tissue issues with lichen sclerosus. So knowing that that was even an issue was important for me. And then knowing how to kind of work on that and address that was incredibly helpful. So I spent the next maybe 6 months working on that releasing of those muscles. So my pelvic floor physical therapist taught me something called a reverse Kegel. That involved a lot of like visualization. I think she realized that I'm a very visual person, so she would often give me very visual cues to kind of help me with those, actions. So, I spent a lot of time working on relaxing the muscles. At this point, I wasn't using dilators. I do talk about this in other videos, how we also incorporated dilators and that did not work. I talk about this in my ebook on dilators. But the reason was I just rushed into it and I wasn't, addressing these mental health pieces around anxiousness and fear and trauma to the vulva and the vagina. And I wasn't, addressing the pelvic floor muscles. I was just kind of like, let's do it. So instead of, my first few months were just learning to kind of relax, and we did that through visualization. We did that through like body scan meditation work. And she also just taught me a lot of ways to kind of regulate the nervous system and encourage, stress reduction, which again, incredibly important. It's just, it just keeps coming up because it really is an important topic. So I learned a lot of these things, and I think that this was incredibly helpful, learning to relax the pelvic floor muscles, learning techniques to kind of regulate stress and regulate my immune system, which had been chronically charged for years, which, can cause a lot of issues. So I was also doing pelvic floor physical therapy along with sex therapy, along with treating with clobetasol. And then 9 months came. And I gotta say, those 9 months were very long for me. Even though I had seen by 9 months, my symptoms were very quiet. I think there was some lingering itch and discomfort and like the feeling of dryness. But other than that, they were pretty much subsided. I didn't feel those fissures anymore, that stinging, that burning, all of that was gone. I didn't experience any improvement to pain with sex because if you've been following my story, I wasn't having any at that point. So there was no way to kind of gauge if there was any improvement there because I simply wasn't engaging in it. So I showed up for my 9-month appointment. I was a mess. I cried on the way there. I cried in the waiting room. I cried on the table. I cried afterwards, walking home. Okay, I just cried and had a bunch of panic attacks and anxiety. I came prepared with like a scroll worth of questions and concerns that I had for them because, at this point, it had taken me, I had 9 months with no answers and no guidance. So I had a lot of questions. And when he was examining me, he actually said that he could clearly tell that there was lichen sclerosus just because of the architectural changes and certain cues that he's kind of looking for that indicate that this patient did have has lichen sclerosus. But he said that overall my tissue, the vulva was looking incredibly good and that he was happy with how I was progressing. When I told him that I was still on daily and had been doing daily applications for 9 months, he was like, whoa, nope, halt. We're going to move you right into maintenance. He was like, that's way too long to be doing daily, especially for someone that doesn't really have much signs and that doesn't have any, or that really doesn't have a lot of symptoms. He's like, no, we're going to reduce you down to 2 times a week. So he gave me my schedule, spoke about how I was going to use it. He really took his time. I think he took like 45 minutes with me, which in Canada is a lot. I don't know if that's because I was a sobbing mess, but suffice it to say he took his time and kind of answered through those questions. So I was like, oh, maintenance. Okay, never heard that before. But all right. And I'll make a video actually on how I moved from daily to maintenance because there's actually a lot of important pieces of wisdom that I think come out of that. So I'm going to do a separate video on that. But he put me on maintenance and then he said, we're going to have you follow up in about 6 months, 4 to 6 months. I don't quite remember the exact, spacing, but it was definitely 6 months or less. It wasn't a full year follow-up. So let's just say about 6 months later, I go back and he tells me, you are looking incredible. Your lichen sclerosus is in remission. He said, if it wasn't for the complete, loss of the labia minora and the pretty severe adhesions around, the clitoral glands and the clitoral phimosis and some of, this stuff that's going on. He's like, I wouldn't know that you had lichen sclerosus. The tissue just looks that healthy. At that point, I had no more whiteness. The skin had returned to pink for me. And I say, for me, because not everyone has a pink, labia minora and a pink clitoris or clitoral hood. So don't think that to be in remission, it needs to go pink. It just needs to go to whatever is your healthy baseline. So I just want to put that out there. But my color had completely returned. The tissue was looking great. And he was like, yeah, you're in remission. This is fantastic. keep up your maintenance doses, keep applying coconut oil as your emollient. I did tell him that I was going to pelvic floor physical therapy, and he was super happy to hear that. He was like, yes. He's like, I totally recommend that, and good on you. And so that is kind of my bizarre little journey into remission with lichen sclerosus. So to kind of wrap up this video, this is kind of how I accidentally got into remission. And again, I say accidentally only because A, I didn't know that you could get into remission with lichen sclerosus, and B, I didn't have any specific guidance or help or support or resources, to explain, what things are beneficial to get into lichen sclerosus. So I was kind of doing a lot of the right things. There's some things that needed tweaking for sure, such as how I was applying my medication. But suffice it to say, I still got into remission, and I kind of think my good intuition, I guess. I think when you are a person with chronic illness and chronic pain, and you've been living with that for long enough, you kind of have a good sense of, what are some things that I can do for my mind and body in general that will be supportive to, managing the symptoms, managing the pain, the discomfort, and all of this. And so thankfully I did have some of those good gut intuitions, such as get a sex therapist, go to pelvic floor physical therapy, work on stress and stuff like that. So that is part one of this story. In the next video I'm going to film, I'm going to tell you all of the things that I do now to stay in remission. And now it's not an accident anymore. I'm not kind of fumbling, and there's not so much guesswork, and I'm not sure what I'm doing. These are the things that I do now that I've kind of learned are crucial and important to do in order to stay in remission. So definitely subscribe and be sure to keep a lookout for that video, which will go up 2 weeks from now. So that is it for this one. Thank you so much. If you found the information in this video helpful, or it resonated, or you have any questions or comments, please leave those below in the comment section. Leave this video a thumbs up, and I will catch you in the next one.